Welcome back to Voices in Health and Wellness. This is the podcast where we explore how practitioners, founders, and innovators are reshaping what healthcare looks like across clinical work, business models, and the future of care. Today, I'm joined by Dr Hwaida Hannoush, a specialist in metabolic cardiology and functional medicine, and founder of Pressi Med Clinic. Hwaida's work is focused on helping women over 35, particularly those at higher risk, prevent heart disease before it becomes a crisis. What's especially interesting about her approach is her transition from conventional cardiology into a more functional, root cause-driven model, bringing a much broader lens to cardiovascular risk. So with that, Hwaida, I'd love to welcome you to the show. Thank you so much for joining us today.
Thank you so much for having me on your show, Dr. Greenland, and it's my pleasure.
Wonderful. So could you walk us through your journey from conventional cardiology into functional medicine and tell us a little bit about what triggered that shift for you?
Wow, it's a long journey, actually. So because I spent a lot of time in training in conventional medicine, and at the same time, I always had the research mind, looking for answers to my questions. So I've always, since even my medical school, tried to do research. And then I went through the classic steps into cardiology. Along that, I had also published many research articles, and I've always had question why in my mind when I did my research. And along the way, I had personal exposure with medical situations where I got no answers. So still didn't know about functional medicine. I dedicated myself to pure research work environment instead of working in a hospital or private practice. I dedicated myself to pure academia at the NIH, and more so in imaging and trying to be specialized in advanced imaging to try to detect heart disease before it becomes overt, and especially in patients. NIH is more of they have a lot of cancer patients, and so my aim was always to look for things before disease becomes in its worst stages. With that said, along that way, I had as I mentioned, I had personal family illnesses where no answers were given at all levels, at all ages in my family. And so that is when I was looking for answers, more answers, and I came to know about functional medicine, which is root cause medicine, and that satisfied my what you call or relieved my soul in finding, I found it, eureka, that's it. And then I said, since I have a background in cardiology, why don't I focus on cardiology prevention? And then I found that women are very disregarded, their symptoms are invalidated, they are undertreated. So I said, okay, let me focus on women and empower them to recognize that heart disease is the number one killer. Unfortunately, nowadays, only 56% of women know this information. They think it's cancer more than heart disease. And unfortunately, as well, around 60 million in the US are struggling with one form of heart disease or another. And it's not only that that I read statistics and guidelines. You can say I've experienced it firsthand when I talk to my cardiology colleagues, but my male cardiology colleagues who still stick to the conventional risk stratification and discuss things differently with women in terms of risk stratification. ignore the reproductive risk history in women as well. And that is when I was more adamant in pursuing my niche to empower women. And actually, not only I do a lot of education and webinars, but also I created a community for empowered women hearts, because this is my goal in life.
Amazing. Thank you so much for that really helpful background and context. So just digging into that a little bit, do you have any sense of why there is this differential between men and women? You said that women were underrepresented in all sorts of ways. Why specifically in heart disease is there an issue in your opinion?
I want to say women, to start with, are more complicated probably than men with their physiology. They have a lot of hormonal differences. They have on top, including their reproductive physiology. That's a statement I want to also add to it, is that women's symptoms are different from men's symptoms, and that's what makes the whole story different and misleads the health attention or planning or journey. Women may just complain of fatigue while they're having a heart attack. They may just complain of stomach upset or discomfort. They may have some kind of pressure in their chest, which themselves, unfortunately, and there is a recent actual publication on this, they're becoming more and more disregarding themselves, their symptoms themselves. It's not only the doctors who disregard it, because they think, okay, I'm tired. Maybe I didn't sleep well. Maybe I didn't, rest well. Maybe I overexerted myself. And so they ignore themselves. And then coming into the real medical physiology, besides what I've mentioned, women have more add-ons in their disease pathologies. They don't have only big coronary artery diseases or atherosclerosis. They're very prone to microvascular disease. And thus comes another phenomena, which is HFPEF, heart failure preserved ejection fraction, which is up to the moment being studied. They have, they have also their pulmonary hypertension. They have extra risks besides what I've mentioned as far as hormone and reproductive risk factors. They have the side of autoimmune risk factors. Every time we studied in medical school autoimmune diseases, they said, oh, it's prevalent more in women than men. So these are risk factors also that contribute to cardiovascular risk factors. So in other words, I want to say women physiology is very complicated, whether it's symptom-wise, whether it's disease-wise, whether it's risk factor-wise. I want to add also, even the classic risk factors make a woman more prone for cardiovascular disease than a man, like simple one, diabetes. We all know diabetes is a risk factor for heart disease. If a woman and man have the same diabetic numbers, risk factors are doubled in a woman more than men. Having same numbers, having same, if you want to say, treatment. So, yeah, it is a very complicated situation in a woman.
Really interesting. So you've come from a conventional background, and looking back now, do you feel that traditional cardiology is evolving fast enough, or are they still missing the trick here?
I believe, and please, for all my colleagues, they're still missing the trick. When I see that they're just ordering the classic cholesterol, HDL, NDL, and then focus on statins, we are still missing the trick. That's my conclusion.
Interesting. So let's bring this down to the sort of the patient level. And what would you say are some of the early warning signs that women should be paying more attention to before disease develops? There'll be people listening on this call that won't be as enlightened as you in this world. What should they be looking out for?
First of all, before we talk about the symptom, we should inform the woman about her body and her risk factors, starting at a young age, whether when it's when she starts having menses, any abnormal symptoms in menses. We were told dysmenorrhea is normal. This is not normal. Then during reproductive age, when they have complications, they are lost to follow with cardiologists like pre-eclampsia, gestational diabetes, even uterine growth retardation is a risk factor, placental abruptions, because after all, whatever vascular physiology is happening between the mother and the baby is also a risk factor for future cardiovascular disease. Unfortunately, these complicated cases, they are not referred to a cardiologist after delivery. So I want the woman to know her risk factors before she starts experiencing symptoms. The other thing, now we come to the symptoms, as I mentioned earlier, symptoms are very atypical. If she feels a pattern with even an awkward symptom like pressure or a shortness of breath that is repeating, not till till it's become very bad, but I mean a slight pattern, a subtle pattern that's repeating itself with her, she should pay attention and shouldn't ignore herself, and should seek medical attention right away. She should be also, when she seeks medical attention, if disregarded, she should know what she needs to check for, and she needs to enlighten the physician also that I had this and this risk, and including reproductive risks in the past. So I need please to be checked. She should be a partner with the doctor in her health journey.
Thank you. So are patients becoming more proactive and educated about prevention, or are most people still reacting to a situation when it arises, from what you're seeing at the moment?
Unfortunately, from what I've seen, they're still reactive and try to have false reassurance. I've spoke with women who are severely symptomatic and they're still agreeing that they're gonna be okay no matter what, even though the plan is unchanged and nothing is changed about digging deeper into their health story. So yeah, it's still reactive from both sides, women and the doctors. We're very good in healthcare system at addressing acute situations like acute MI, opening arteries, acutely, emergency, though there is a bit of delay when it comes to women as well. What we call in conventional cardiology door to cath lab timing is still longer in women, but the techniques are excellent. We manage very well acute situations, but it's all reactive, and there's no proactive environment.
So you're in a fast-moving space. What trends are you seeing in functional medicine or metabolic cardiology that are really exciting you right now? What are you looking to the future for in terms of the space that you're in?
First of all, not only because it's root cause medicine that I'm excited about functional medicine because it links all body systems together. And that's a huge excitement to me as well. I don't look at the heart alone. I look at all other organs. I look at the milieu, the environment, the inflammation, the cardiometabolic, and yeah, going back to inflammation, the gut health, hormonal situation. Um, Not only that, I'm trying my best to advance. I mean, no, it's not advance. Moving earlier the prevention knowledge, and not waiting for menopause when the whole problem starts, to start addressing cardiovascular health in women. So I'm moving every time I'm moving earlier, and as you heard me, I say, okay, teenage. Honestly, atherosclerosis can start in utero, but let's wait. Let's start educating the teenage, the and afterwards, and we'll get there hopefully. Yeah.
Thank you. So really good insights into your philosophy and your approach to the functional medicine, the value of functional medicine, root cause medicine. But could you talk us a little bit about what your clinic is, what the setup is for your clinic? So Pressi Med, what it looks like today.
Pressi Med is a virtual clinic, only virtual clinic, so that I can have access to as much as I can of women. And it's not only that, I've made it, since it's a virtual clinic, it has all the technical capabilities, whether starting from RPMs, ordering tests, functional medicine tests, or even blood work. Everything can happen from a distance. Communication. What is so special about Pressi Med is that I have patients have access to me 24/7. They chat with me through the EHR, and they don't have to wait for long waits to contact the doctor, and they access me directly. So this is one thing about Pressi Med Clinic. And I'm very happy that I'm doing it this way, because I hear like sometimes, and I know it for a fact, patients wait for 6 months to be with a specialist, and things can't wait. Otherwise, they will end up in the emergency room and waiting the long hours in the emergency room. So yeah, this is one thing about Pressi Med Clinic.
So what does a typical day look like for you running a solo telemedicine practice? And I know no 2 days are going to be the same, but just give us some sense of how this kind of maps out.
So it's split into sections. First part of the day is attending to the messages, as I mentioned, or emails from the patients. The second part is seeing patients, and then the third. This is a general, because there is one day where I dedicate a community Q&A weekly. So yeah, but the general is patients as a start, messages, emails, then the seeing the patients or clients, and then there's the education part, and whether it's my education or others' education, attending webinars, conferences, or writing, whether I write in social media or I write for newsletters. I'm a member of many newsletters, and yeah, later on I can share these. And then let's not forget the marketing part, technology part, AI part, So yeah, this is how it goes.
So
Yeah.
it sounds like you really cracked the model. What are you most proud of in what you've set up? What's working especially well for you in the business?
Uh, I'm so proud that I discovered this route and I am able to help as much as I can. I know one hand, we have a saying, one hand cannot clap. But I wish I did. The only thing I regret, I wish I did that earlier. But I mean, everything comes in its own timing. I'm so proud of also with the feedback from my patients, their their comfort. Even though having a mindset of remote or telemedicine is not strong enough up to the moment. Many patients still feel they need to see the doctor in person. Yeah, I'm so proud of what I've done so far as the patients and myself.
That's a remarkable achievement, what you've just been going through. But I guess there must be some frustrations or challenges in doing this kind of model. What are those?
Yes, of course. I have, to be honest, I have a lot of frustrations. I mentioned part of it when I told you about the mindset. The mindset of the healthcare system and the patients themselves. It needs a lot of work. Even collaborating with other physicians like other GPs and trying to, or specialists, and trying to introduce the concept of functional medicine, they completely dismiss it and try to cut short the conversation with me. This is a big frustration, and this is one thing. The other thing, of course, is coverage of the functional test, the financial part, because some patients, they're so eager to be attended to by functional doctors, but the cost of the tests is not reimbursed by insurances, and so they have to pay out of pocket. And this is another point I want to just interrupt. When I was in conventional medicine, I used to try my best not to test. But when I went into functional medicine, I I became a believer, strong believer in test, don't guess. Yeah, so instead of ending in a bag of supplements instead of a bag of medications, or it is not necessarily supplements, but I mean the concept per se, treat for an ill. So yeah, these are the two main: the mindset, the and the communication with conventional doctors, and the financial aspect.
Thank you. Really, really good insights. What about the sort of operational business challenges in running a platform like this? You've talked about the mindset and the communication stuff. That's a people thing. But what about the day-to-day nitty-gritty of running the operations of the platform that you have?
I have a lot of automations that help me with this day to day as well, if that's what you mean.
Mm.
And of course, yeah, that's why I told you technology is very important. Um, and yeah, technology is my best friend in this, in smoothing the flow of work. Yeah. I hope this answered
No, it
your
does. It does.
question.
No, absolutely. The whole point about the podcast is to understand some of the things that we never really hear about. The day-to-day challenges of running businesses and clinics, and this is really, really helpful. So, I guess if you had a sudden influx of new clients next week, nice problem to have. But would anything break? I mean, what would happen if you had 15 new clients next week?
Um, let me feel this, because I don't have 15 clients per week. They go up to the moment, because it's a newly launched clinic, but nothing will break. Everything will be flow. Everything is ready for the patient from day one till we go with their journey. Yeah.
So you've obviously put a lot of automation into your system to support
Yes.
you, but what's the
Yeah.
biggest time drain for you personally in the work that you do? Is there anything that takes you away from what you really like doing?
No, not at all, because I take my laptop wherever I am. I am a mother. I have a kid who is an athlete. I go with her all tournaments. Over the weekend, I was out of town. I was having my laptop with me and working while attending to her tournament. I coach her, sort of, if you want to say that. And I have I have other hobbies beside traveling. I also interested in, I like cooking. I love cooking and entertaining and people, social events. So yeah, it doesn't take me away. It is just this online presence made me uh, flexible with my schedule. Um, I have to admit that as I mentioned, I am working over the weekend, but during the weekday, I may have free. Actually, Friday is a mostly free day. This is not the norm. You asked me about my regular days.
Mhm.
I have a Friday is mostly dedicated for contemplate not con- I don't want to say the word contemplating, um, thinking time
Yeah.
of new ideas and new event. Just it's my own my own time with myself to just think and maybe do some collaborations as well with other functional doctors and bring up some ideas. Yeah, that's and yeah, you don't want to know that I have a lot of ideas on the go on the to come.
Love it. No, I totally get it. And I think, thinking time should be scheduled. I think it's very important. It often gets squeezed in the way that practitioners work. We're all kind of working really, really hard, trying to see as many patients as possible, and forget we need that kind of contemplative thinking time. So I totally get that.
Yeah.
So are there any challenges around, the balance between being a practitioner and a business owner? I mean, it sounds like you've nailed this, but I'm just curious to know if there's anything which upsets the balance.
Yes, of course, especially that it's a startup, um, because you have to learn other things that are not related to your specialty. I had to be mentored and spend time as if I'm in school, in a business school again. I have to do some work that I wasn't used to doing. Yes, of course, this is very challenging. And you would probably say, oh, why would I do that? Let me hire somebody and that's it, and spend this time doing something else for my specialty or clinic, or not only that, even for my family as well. But going back to it and looking at my journey, learning business, I think it gave me a lot of information also about the pain points of the clients. When I called them, when I discussed things for them, when I had discovery calls and trying to see, to do it from the business point, you have to do discovery call before they enroll in a program. That's like a journey. That's a stepwise journey. So I think I learned a lot. And plus the business part, I learned a lot about. Yeah, it is challenging, as I mentioned, time-wise, effort-wise, but it's worth it to know.
Thank you.
And plus, sorry to keep to say one more thing. And plus, in the future, when I want to enroll or employ an assistant, I know what's happening. It's not that so that I can teach my assistant to how to address issues. If I didn't know all of these things and immediately hired someone, I don't think it would have worked. I would have a turnover of assistants. So learning things myself and then teaching them to my assistant, who I hopefully I will hire. Yeah, that makes a lot of a difference.
Very sage advice. I like it. Now, you've talked a lot about social media, and you also mentioned earlier on about the sort of the awareness problem. What messages are you trying to get out there for people to read to try and change that mindset of reactivity rather than being proactive?
Lots of things in their mindset. First of all, it's not only about the scary, the alertness that cardiovascular disease is #1 killer. It's about knowing what are the risks, what are their symptoms, how they are different, and what they should do, and how they should interact with their physicians and ask questions, and they should be their own best advocates. That's the bottom line. There are lots of myths ongoing. It's not only the cholesterol myth. There are lots of them, lots of others. So I'm not gonna dig into these now, but having what I mentioned as awareness of how to handle the situation and ask questions and ask the why. This is also another important. Why do I have high cholesterol, for example? Why I'm still short of breath while my tests are normal? There's always a why. And that's how I actually, Dr. Greenland, everything I do with the patients, I'm doing it as if I'm dealing with myself and my family. And I went through this in every simple clinical situation in my family. I always asked why to find the answer. So this is #1 recommendation in the mindset. Ask the why, know your body, know your risks, and don't also accept we don't know also for an answer, because I got this statement myself and my family. We don't know, or we don't have a treatment.
Thank you. So, next 12 months, what would you like to achieve in the next 12 months with the clinic? Where's everything going for you?
Wow, this Friday off is bringing a lot of ideas. You started saying I help 35 plus. I'm going younger in raising awareness. And I'm starting with my daughter, who's 14. Not only going younger and addressing special populations as well, because there are populations who are at more risk of heart disease. I'm talking about from women as mostly right now. In the next 12 months, I'm sticking with the women niche. And so, going younger, special populations, just off the burner, if you want to say it this way. Athletes, this is very important. They are a special population who needs special attention as well. This is for the time being, I see myself.
Okay, I'm going to give you a crystal ball to look in. How do you think preventative medicine is going to evolve over the next decade from your standpoint of what you're seeing?
If we don't change the way we look at medicine, ill for the pill, and wait for the disease to happen, preventive medicine is going to be staying stagnant. I want to say something just as a transition statement. Functional medicine is not a magic or something out of the norm. Everything I learn, I tell myself, I've learned this in medical school the first 2 years. All the biochemistry, the physiology, everything was learned. But then in the second half of the training, we were shifted in a way to get a diagnosis and give a medicine. Even it's funny because the first thing when I graduated, I was worried that I will forget the name of the medications to give for a diagnosis. So this is we have to go to the basics, to the medical school, what we learned, and try to build on that to prevent disease. Otherwise, if we're still practicing the same we are doing right now, I think we're going to be having the same, stagnant. And actually, there was an article about the 2050 projections for women's heart health. And interestingly, they said there's going to be increase in cardiovascular disease. There's going to be increase in metabolic disorders. And then the interesting part, but there is going to be increase in statin use and more compliance with statin use. So you have this discrepancy. You're having more compliance with statin use and treatment of elevated cholesterol, while you're having higher cardiovascular incidence and higher metabolic. So there is a gap here we're talking about. Something is wrong. Yeah.
With that, Hwaida, I'd love to thank you so much for joining us today. It's been a really interesting conversation. Thank you for your insights. Thank you for sharing your philosophy on functional medicine and your preventative approach, but also telling us a little bit about the behind the scenes of running a successful telehealth platform that you have. It's been really, really interesting. Thank you so much for joining me.
So much, Dr. Greenland. I'm very appreciative, and it's my honor. Thank you so much.